I'm Robin McTague, I'm 57, and I'm here at Diane's Lingerie to be fitted for a bra today. It's been 14 years since I had breast cancer surgery. I was really shocked when I was first diagnosed because all the way along I'd been having abnormal mammograms, and they kept telling me, oh, it's nothing to worry about, it's just calcification, we're going to keep an eye on it. And then once we did the biopsy and they told me it was cancer, I was really shocked.
We know here in Canada that just over 50% of women who are eligible for screening are getting regular mammograms. At the Canadian Breast Cancer Foundation, we encourage women to get regular mammograms every 2 years between the ages of 50 and 74. For those who believe that they're at a higher risk of breast cancer, we really encourage them to have a conversation with their healthcare provider, and we encourage all women to make an informed decision.
With the imbalance of my breasts, it doesn't look all that great if I want to wear something that's kind of close fitting. I've got a lot of stuff sitting in my drawer and I don't use it. In the store they seem okay, and when you go to actually use them, they're really not that comfortable or don't work that well. I do a lot of walking, and before going back to work, I wanted to feel comfortable going back to the gym and being able to change in the change room without feeling like I had to hide in a room or something to do that. So it'd be kind of nice to have some information about how to really work with what my breasts are like now. I had been to Diane's Lingerie years ago, but that was before breast cancer or any surgeries. Then a friend of mine just currently told me they're real experts in not only just regular bras, but for women who have had breast cancer. I decided that I wanted to do something more.
Women used to be in the hospital for approximately a week after breast surgery. Now it's a few days if they're very lucky. What happens is they are sent home with drain system management that's generally used for the first 7 to 10 days. And if they haven't made contact with a professional fitter, there they are in a very uncomfortable situation and they don't know what to do.
Most patients will have a drainage tube in situ. They're a round plastic soft tube that has holes in the end of it. It goes underneath the skin, exiting the skin by a very small opening, and it's connected to a very small vacuum bottle that's compressed, and it applies pressure so it aspirates and drains the fluid out from underneath where the breast used to be. Sometimes the patients will just pin the little drainage bottles to their own clothing. There are post-surgical garments that can be purchased that are soft and comfortable, that have little pockets or pouches in them that they can tuck the drainage bottles into.
Amona has a variety of products for the recovery phase, which is the first phase after surgery. And we have post-operative bras and camisoles available for every type of surgery. And ideally, if she has that garment with her, she has something to put on immediately after surgery to give her the comfort and the support and control that she needs.
Post-surgery products are often important because they are structured specifically for comfort on the shoulders and for containing prosthesis.
Sometimes patients aren't initially going to have a full mastectomy, they're having a partial mastectomy, so they need something in their bra to help with balancing. And if they knew that ahead of time, it would help them transition so that post-operatively, as soon as the bandages are removed, they can put on a bra and feel like they're balanced.
What I've heard about Diane's Lingerie is they actually do the fittings for post-surgery breast cancer. They also work with forms or prosthetics.
A breast form is a specially designed and crafted silicone prosthetic that restores a woman's natural silhouette. And they are often used after a lumpectomy where there's been a fair amount of tissue loss, or after reconstruction if the front part of the breast requires filling in. This is a contact breast form, and they're designed to mimic the natural drape and feel of natural breast tissue. So we have different densities, different weights, and different shapes. This particular breast form can be worn directly on the skin and is easily removed. It also comes with a soft pad, and with the soft pad you can then put it in the pocket of a bra. When you move, it moves with you instead of against you.
Out of today, I think I'd really like to get some really nice fitting bras and know what to actually ask for. Yes, I am ready to meet the bra fitters.
It's in our store right now, so we can have a conversation out here. It's quite private. I'm Gloria. I'm an after-surgery specialist here at Diane's. Come with me.
It's kind of a bit nervous, but exciting. They fit me in a regular bra and then a sports bra and added the partial.
Take a look up there. Right over here, there's a perfect mirror.
Wow, that looks so balanced.
And see how...
I was really surprised. It felt really comfortable and it made me feel really great because it was like, wow, I look normal. I don't look like I've had 5 surgeries. You really couldn't tell. Both breasts looked the same. So it was really amazing. Well, I was surprised how easy and comfortable it was. It didn't feel so clinical like I thought it would. I'd never heard about some of the things like the prosthetic that she used in the sports bra. I guess I kind of had an idea that prosthetics would be kind of uncomfortable and I'd have to be worried about it moving all the time, but it just fits to the skin and it's really comfortable. I had no idea. I wish I would have done this a long time ago. I've been 14 years with looking at myself in the mirror and thinking, oh, that doesn't look so great, and to be able to just look at myself in the mirror and say, wow.
There's a lot of fear and apprehension at the beginning of the process. She looks at everything that she has in her lingerie drawer and thinks, I will never be able to wear any of this again. I'll never feel like myself again. And I'll never be able to go about the activities that I normally do in a day.
I want people to see me and not the breast. So thank you.
Diane's Lingerie is a very important part of the team for breast reconstruction, and I think it's a continuation of care that the patients receive there that allows them to feel supported on every level.
We don't pretend that we're replacing a breast, but if someone can be so comfortable that they can forget that they're wearing it, even for a part of the day, it's definitely to their advantage. If you want to tell someone you've had a mastectomy, that's up to you, but people shouldn't just look at you and know that.
It's really hard to be your own advocate, but take the time that you need and go for a fitting. Life doesn't stop. In the 14 years that I've been dealing with cancer, from cancer survivor to cancer thriver to cancer graduate, and I really like that term. I am 14 years a cancer graduate.
We're pleased that the Canadian Breast Cancer Foundation can raise awareness, that we can fund research. We advocate for screening. We provide support and information services to women who have received a diagnosis and are looking for that care. And we offer education and awareness. And we couldn't do all of that without our donors and without supporters like Diane's Lingerie.